Hello, everyone, and welcome to Talk with a Doc, the show where we bring your questions to Providence St. Joseph Health medical experts for insight and information. I'm your host, Mary Renoff, and here with me today is Mona Garcia, a registered nurse and diabetes educator at Providence Holy Cross Medical Center. And today we're answering your questions about gestational diabetes. Remember, everyone, all of our questions come from listeners via social media. We can be found on Twitter at PSJH and on Facebook under Providence St. Joseph Health. Use the hashtag #TalkWithADoc. That's hashtag #TalkWithADoc for the chance to hear your questions on an episode. Before we start, I want our listeners to know that the information provided during this program is for educational purposes only. You should always consult your healthcare provider if you have any questions regarding a medical condition or treatment. Okay, Mona, well, thanks for joining us today. Tell us a little bit about your role here with Providence.
So my name is Mona Garcia. I'm an RN. I'm a certified diabetes educator. And here at Providence Holy Cross, I see inpatient and outpatient diabetes patients of all ages. Really enjoy my job and love working here.
Make a pretty big impact in your life.
Yes, for sure.
You do.
Thank
Well,
you.
we appreciate the work you do. Well, today, guys, we are talking about gestational diabetes, and we have taken your questions via social. And Mona, we're going to jump right in, and we're going to start with the big one. How does gestational diabetes affect my baby?
So when you have gestational diabetes, how it can affect the baby is the baby is more at risk for any birth defects, heart defects, major birth defects, miscarriage. You can have a very big baby, like over 9 pounds.
Ouch.
Yes, and a low blood sugar after birth, and they're more at risk for jaundice. And actually, what's really interesting is they actually are more at risk of having obesity later in life.
Really?
Yes.
Why is that?
We don't know. It's, some of the research has shown that because of the increased blood sugar in the mom, that gets passed to the baby. So the baby's pancreas is starting to make more insulin to keep the blood sugars at a normal range. So we're thinking this may contribute to being at risk of obesity later in life.
Okay, so if you have gestational diabetes, can you unhave it? Can you change something to get rid of it during the pregnancy or no?
Not really, because the hormones from the pregnancy actually make your body more resistant to insulin.
Oh, wow.
So you can eat healthy. And again, the meal plan is something all pregnant women should eat. But we know it's challenging when you're pregnant because we do crave a lot of other unhealthy foods. So just really following a meal plan and being active can keep your blood sugars in range.
Okay, for those listening then, what would you consider to be a healthy meal plan?
So for a healthy meal plan, we want to do, try to avoid the juices, the sodas, really increasing your plate with vegetables, protein, watching the carbohydrate portions.
The yummy ones.
Yes. Having not too much carbs, really watching our portion, which is definitely a challenge when a woman's pregnant. But the best thing about these patients is they're very motivated because they are eating for two and they want the best for their baby.
I'm just going to say it, Mona. Eating healthy is hard for women, whether we're pregnant or not.
Very true. Very true.
I don't know why, but as a woman, I feel like I crave more sugar and salt than everybody else. I don't know why.
It's very true.
Well, this question says, will gestational diabetes give me complications during delivery?
Yes. Think about it. If you have high blood sugars during your pregnancy and you have a big baby and have to deliver that baby, you're going to be at risk for some lacerations during delivery. You might be at risk for delivering a C-section because your baby's too big.
Okay.
The baby can have a clavicle fracture trying to get out. It's too big.
That's the shoulder?
Yes.
Okay.
Yeah, because that baby's just too big to pass.
Ooh, that just sounds horrible the way you said that. It's too big to pass.
Yes.
Yeah.
So we don't want to have big babies. And, many people think, oh, well, big babies are good, but we don't want the baby to grow too big, too fast. I kind of say they're not fully baked yet. Not the lungs or all the organs are fully developed, and the baby could already be 8 pounds at 8 months, which is not healthy.
Yeah. Wow. Okay. Well, then this leads into the next question then. Should I plan to have a C-section if I have gestational diabetes?
No, that doesn't have to be the case. So again, really eating, watching your portions, moving more, trying to de-stress, that's going to help you keep your baby at a healthy weight. So if you can keep your baby, below the 9 pounds, then you don't necessarily need to have a C-section. So I think everybody should strive to have hopefully a nice, normal, easy delivery.
Are there exercises, or you said stay mobile, stay active, are there things that are better for pregnant women to do than others?
Most women find that walking is one of the easiest, or sometimes in the pool, just walking in the pool, swimming, because when you're pregnant, your joints are a little more, more flexible. You're carrying extra weight. You're a little more short of breath. So you have to do things that are not too high impact. And especially looking at what your activity level was prior to the pregnancy.
Sure.
If you were one that was very sedentary, you can't think you're going to run or do a crazy cycle class while you're pregnant if you weren't doing that before pregnancy. So I definitely encourage my moms to walk, swim, and really do something they enjoy.
Is there a flip side to that? If I was a hardcore runner or something before, should I not as much if I have gestational diabetes?
Well, it depends. If you have gestational diabetes and you're managed just with diet, you can probably continue your same activity if the doctor gives okay. We wouldn't recommend anything less, as long as, if you're on insulin, then maybe we might have to make some adjustments to your exercise routine.
Gotcha. Well, this question says, am I more likely to get gestational diabetes if I'm an older pregnant woman? I'm 46. Okay, that's not old, but okay.
Yes, unfortunately, too. If you are over age 45, it does make you at risk for having gestational diabetes. Some other risk factors are just if you're overweight, kind of sedentary lifestyle, you have a family history of diabetes, history of diabetes or gestational, African American,
So wait,
Hispanic.
gestational diabetes can actually be like a family thing?
Yes.
Okay. And again, is that lifestyle or is that genetics?
Probably combo of both. You
Okay.
have to think most times, to know a person definitely has gestational diabetes, it's truly only during the pregnancy. Okay. Sometimes women don't go for their annual checkups, might have had diabetes before they got pregnant and not known. So there's lots of variables when it comes to the gestational diabetes and really knowing, is it gestational or is it you had diabetes and you didn't know.
How does the doctor make that distinction?
So sometimes what we look at is if they had a high A1C, when they initially get their blood work done, they might have a high glucose value. So that might prompt the doctor to say, oh, okay, let's test you a little bit sooner. Sometimes when we talk to the patients and they're like, oh yeah, I kind of was told in the past my blood sugar was a little high and I didn't think anything of it.
Gotcha.
So
do doctors test for gestational diabetes in every pregnant woman?
Yes. So it's usually done between about 24 to 28 weeks.
Oh, okay.
But if you do have a history of gestational diabetes or strong family history, then you might want to get tested sooner.
Okay. And it's the same way to test for it, the AC1 or
No,
A1C?
we usually go by it's called the oral glucose tolerance test.
Okay.
So it's an OGTT. So what it is, most pregnant women will know they had to drink this horrible solution, go get their blood sugars drawn an hour later. So it's basically like a glucose challenge. You're basically challenging your body. Let's see what happens when I drink this. It looks like soda, but it probably tastes like syrup. So you drink that and you see what your blood sugar does in an hour. You go get your blood drawn. If you're in range, then we know your body can handle that big surge of carbohydrates.
Okay, interesting. Well, here's an interesting question. Will my diabetes end when the baby comes?
So if it truly is gestational diabetes, then yes. Once that placenta is delivered, the hormones are done being produced. So yes, it will be gone. But if it was diabetes that we didn't know you had before pregnancy, then it's something we'll have to continue to monitor.
So I know some women save their placenta. If you're gestational diabetes, would you not save your placenta? Or
Not necessarily. I mean, I don't think it would make an impact on it.
Okay. Well, are there long-term effects from having gestational diabetes?
So when you do have gestational diabetes, you do have a higher risk of having it in a next pregnancy.
Okay.
You do have a higher risk of getting diabetes later on. So
Like type
Type
2?
2,
Okay.
yes. So we usually recommend to our moms, after the baby's born, we know you get busy with the baby, but please try to continue the healthy diet lifestyle that we talked about, really having the balanced meals, being active, and getting a checkup. I know many moms kind of put their health to the side and not get their checkups done.
Got it. Okay. Well, how common are you seeing gestational diabetes?
It actually occurs in about 2 to 10% of pregnancies.
That's pretty high, isn't it?
Yes.
Is that consistent or has it grown over time?
It's been pretty consistent and maybe has grown a little bit because we have gotten better about diagnosing it and really paying attention and testing women sooner. Because many women would kind of, that were at risk and we knew that you had it on your previous pregnancy. Now we're really pushing to get them tested sooner.
That makes sense. Well, this question is, how serious is gestational diabetes?
Well, it's pretty serious. For the mom, you can have some preterm labor. You're at risk for bladder and other infections because your blood sugars are high. You increase for infection. You can be injured from delivering a big baby. More likely to have a C-section, high blood pressure, preeclampsia, which is actually high blood pressure and protein in the urine.
Preeclampsia, I've heard that mentioned. I don't really know what that means, though.
So, yes, that's actually a combination of having the protein in the urine and having a high blood pressure, which is very dangerous for the mom and the baby because that blood pressure can get pretty high.
And is that what causes early delivery?
It can because the doctor might deem he needs to pull the baby sooner.
Oh, okay.
To, get that mom's blood pressure under control.
Okay. And are you finding that women with gestational diabetes, pregnant women, are having to are they the ones that have to go on bed rest sooner, or is there any correlation there?
Sometimes, if we have a patient that blood sugars are just really out of, control, very high, they have the preeclampsia, they're on bed rest, then there might be a little bit of a correlation, but not necessarily because we have many moms that, follow the lifestyle, eat healthy, be active, and they have a normal, healthy pregnancy.
Okay. Well, this question says, will my baby be born with diabetes if I have it? And I think you mentioned that there's a stronger tendency for them to develop it later in life, but they're not actually born with diabetes.
Correct. They are not born with it, but they do have a higher risk of having a low blood sugar after delivery if mom's blood sugars are high.
And what does that mean for them?
So that just means the baby might be a little shaky, jittery, so their blood sugars are registering low, so the nurse might have to intervene, give some glucose water or, do a little extra poking and prodding, which we never want a newborn to have to go through if we can prevent it.
And are nurses trained for dealing with gestational diabetes pregnancies?
Yes, I would say, and especially here, Holy Cross and other Providence facilities, I feel we do a profound amount of education with the nursing staff. Our OB doctors are great on board and always want to know what new is coming for our diabetes program. So they're very receptive and we work very hand in hand and well with them.
What is new? What is coming down the pike?
Just in our, just our inpatient, we have new orders that have actually been very nice for our moms that come in with high blood sugars that we have to put them on an insulin drip. So some of our physicians have been really on board with making sure they know how to order it, and our nursing staff has been great with implementing it.
So how are these mothers then? Are they taking insulin? Is it injectable? What are they doing?
Yes. So if, we teach them how to eat healthy, move more, we have them check their blood sugars. If their blood sugars stay, below the 140 through the whole pregnancy, then we don't need to go to insulin. But as the pregnancy progresses, the hormones increase. And we need those hormones because that's what maintains a pregnancy. So it's very common. Sometimes, the patients can be doing everything they need to with eating and with activity, and we still need to start insulin. And I explain to them it's the hormones that her body is producing, and it just makes your body more resistant to insulin. So if they are on insulin, sometimes they're on 2 shots a day, sometimes 3.
Wow.
Yes.
And are you seeing advancements in the way that we take insulin or we do our blood sugar tests?
I would say that's kind of been pretty consistent, just to the fact that it's not very easy to test different medications on a pregnant woman because they're a vulnerable population. So we still have our old standby of our older insulins that we know have good outcomes. The babies can handle that insulin. The moms can do it. So it's been pretty steady. I would say some new things the moms may do now is have actually that continuous glucose monitor where they can actually wear it and it tells them what their blood sugars are every 5 minutes versus poking all the time.
So when you say wear it, is that something that's like a port into your body, or is it external?
So you actually insert it with the needle, and what stays in there is like a little catheter. So the needle doesn't stay in, but the needle is used to insert the little catheter. pull out the needle, and you just wear it anywhere. Some are 10 days, some are 14 days.
Wow. Okay. Well, we'll be right back. We're going to take a quick break. And when we come back, we will have more on gestational diabetes.
Saturday night in the summer, sundown and they all come out. Lamborghinis and they rented hummus. The party's on, so they're heading downtown. Everybody's looking for a come up, and they wanna know what you're about. Me in the middle with the one I love it. We're just trying to figure everything out. We don't fit in well, 'cause we are just ourselves. I could use some help getting out of this conversation. Yeah. You look stunning, dear, so don't ask that question here. This is my only fear, that we become beautiful people. Top designer clothes, front row fashion shows. What you do and who'd you know? Inside the world of beautiful people. Champagne and rolled up nose, prenups and broken homes. Surrounded but still alone. Let's leave the party. That's not who we are. We are not beautiful. Yeah, that's not who we are. We are not beautiful. I drove for hours last night and we made it nowhere. Now I see stars in your eyes when we're halfway there. Now I'm not fazed by all the lights and flashy cameras, 'cause with my arms around you, there's no need to care. We don't fit in well, we are just ourselves. I could use some help getting out of this conversation here. You look stunning, please, so don't ask that question here. This is my only fear, that we become beautiful people. Top designer clothes, front row at fashion shows. What you do and who'd you know? Inside the world of beautiful people. Champagne and rolled up nose, prenups and broken homes. Surrounded but still alone. Let's leave the party. That's not who we are. We are not beautiful. Yeah, that's not who we are. We are not beautiful. We are not beautiful.
Okay, well, we're back with Talk with the Doc, and today we have Mona Garcia, and we are talking about gestational diabetes. So, Mona, here's the question that we got from a lot of people. Can I prevent gestational diabetes as a pregnant woman?
Not really. Unfortunately, sometimes our genetics or just sometimes the hormones from the pregnancy just make us so resistant to that insulin. So I have some patients, very petite, small, eat everything healthy, exercise, and they still come into the clinic and say they've been diagnosed with gestational diabetes. So I always say it's better to lower your, decrease your odds of getting it. So just really focus on healthy eating, being active. So you do lessen your chance of getting it, but sometimes that's just not enough. Those hormones from that pregnancy just decide that you're going to get it.
It's just not fair.
It's
You're already
not.
pregnant. You're doing everything the right way.
It's so not fair.
Well, that's a bummer. Well, here's one question. I seem really tired and I urinate a lot during this pregnancy. But then again, I'm pregnant. Should I worry or not?
I would definitely continue to get checked. It depends. If this patient had been checked already after the 24 to 28 weeks, start having these symptoms, I would definitely let the doctor know, because even though you were screened, doesn't mean that it can't develop later.
Sure. Well, here's one. What if my doctor isn't testing me for diabetes during my pregnancy?
It's the current recommendation by American College of Obstetrics and Gynecology. So I would assume that all OBGYNs would be testing for it. And if they have not tested, I would definitely ask again and again if you have to, for the safety of you and for your baby.
Because it sounds like you would know. It's not like they just ran the test and you didn't know, because you said you have to drink something and
Yes.
Yeah, okay.
And, some physician offices can get a little busy, maybe don't call for the results. So if you took your test and you haven't gotten a call in 1 to 2 days, I would definitely call and follow up and see what your result was.
Okay. Well, this woman asks, are bladder infections in pregnancy caused by gestational diabetes?
Well, when your blood sugars are high, you are definitely, whether you're pregnant or not, you do have a higher risk of bladder infections. And that is due to your blood sugars are high. That's extra sugar in your bloodstream. So it's kind of you're feeding this infection. So it can grow a lot quicker versus if you had a normal blood sugar and you're not giving that extra food to the bacteria.
Gotcha. So is nutrition or diet impactful of that, or is this just really based on the hormones?
It definitely plays a key part.
Oh, it does? Okay.
Yes. So
Okay.
we definitely want to watch our nutrition, be active, because that does help.
I feel like this is a consistent message. Let's be active and let's watch what we're eating.
Yes, yes.
Gestational or regular diabetes or just life in general.
Correct.
Well, this person asks, I had gestational diabetes with my first pregnancy, and now I'm 2 months pregnant. Should I just assume I'm going to have it again?
I would definitely, maybe request to get tested sooner. Good thing is you are at higher risk if you do have it, if you had it in previous pregnancy. But good thing going into this is you know what you need to do. And hopefully you can it'll be an easier transition for you. Or hopefully you continue eating this way after the baby. So it won't be too much change that you have to do with this next pregnancy.
Now, I think you kind of answered this before, but can I drink milk with gestational diabetes? And will my milk be bad for my baby? So two separate questions, I think, there.
Yes. So the milk you can absolutely drink, but again, milk is a carbohydrate. So we probably can't get the whole gallon and drink it. It has to be within your meal plan, and just watch your portion of your milk compared to your other foods that you're eating and other carbohydrate foods in your plate. And as far as the breast milk, no, we strongly encourage all of our moms to breastfeed. It's not going to impact the baby.
Well, and you said that once you have the baby and the placenta's out, the diabetes basically goes away. So it wouldn't really still impact the baby then.
Correct. Correct. Yes. Because once that placenta is delivered, the hormones are gone from mom and blood sugars will go back to normal.
So this isn't gestational diabetes related, but since somebody asked about milk, what's your thought on almond milk and cashew milk?
I tell patients whatever personally you like, but look at the carbohydrate content. Because some of these almond milk and cashew milk, there can be a chocolate flavored, a vanilla flavored. So if you can tolerate the lactose and like the milk, absolutely you can have it. The cashew and the almond, just make sure we're not getting the sweetened ones.
So every time I talk to you, I feel like I learned something new. And I have been watching my sugar intake, and I've been really good about protein, and I don't pay hardly any attention to carbs. And now I feel like all day you've been saying carbs to me.
So it's time to eat some.
This is just about me. I really need to focus on my carbs. Oh, let's see. We'll take another question. Who's most at risk for gestational diabetes? And I think you've talked a little bit about age and so forth, but what are kind of the bigger risk factors?
The biggest ones I would say is if you go into the pregnancy overweight.
Okay.
That's already kind of putting you at a higher risk. And definitely the family history, the over age 45, African American, Hispanic, Pacific Islanders, Asian, they're all at higher risk of developing.
Those cultures are high risk for diabetes overall.
Correct.
Okay.
Correct. And especially if you had gestational diabetes in the previous pregnancy, then yes.
This is going to sound really weird, but if I have diabetes and I become pregnant, do I automatically have gestational, or I just have regular diabetes? I don't know.
Yes, so you'll just have diabetes.
Okay.
And you'll be managed pretty similar, but if you are on medication, there will be some adjustments, because the recommendation is when you are pregnant is that you take insulin.
Okay.
That not to take any oral medication.
Okay. Well, this question is about multiple births. Is it more likely to get gestational diabetes because I'm having twins?
Yes, so think of the hormones in a pregnancy when there's twins, so you have double hormones. So you definitely are at higher risk with multiple pregnancy.
Does that increase then if I'm having triplets? Or?
Oh, absolutely.
Wow.
Yes.
Okay. That's a lot. Simona, tell me a little bit about the patient education opportunities you have here.
So here at Holy Cross, we do offer an outpatient program. We are a certified Sweet Success program, and that is actually through the California Diabetes and Pregnancy program. So it's really a preventative program through the state of California to prevent any complications for pregnant moms. So we have a special accreditation for that. We have to report our data. We have to have so many hours of continuous education. And basically, Sweet Success's goal is to promote improved pregnancy outcomes and to provide education and resources to us to pass that on to our pregnant moms.
So you're seeing an increase in the number of cases of gestational diabetes over time. Are you seeing a decrease in complications with the education that you're providing?
Absolutely. Absolutely. We see definitely in our data collection the pregnant mom or the moms that have gestational diabetes that we see here in the hospital that deliver definitely have babies that don't weigh 9 pounds and less complications for the baby. So we definitely see a correlation with that.
And is any of your training online education or is it all in person?
It's a combination of both. So to be a Sweet Success program, we have to have so many hours of continuous education. So we do have about half of it online, and the other half, they do have yearly conferences that one of us will attend and come back and disseminate the information.
Oh, so train the trainer.
Yes.
Oh, wonderful. Okay.
Yes.
And then when it comes to patient education, is it in person or is it online?
It's all in person.
It is.
And it's
Okay.
all one-on-one. And some patients we have to see multiple times, and that's okay. You know, sometimes we see them just for diet, and, you know, a month later they might need insulin, so they'll come back and see us, and we'll teach them how to do the insulin and so forth.
And does insurance cover this type of education?
Yes.
It does?
Yes.
Okay. So y'all got no excuses?
Yes.
Okay. And do you, this is just my own personal thing, do you do like food demonstrations, or do you ever take them shopping and show them like how to pick the right kinds of foods?
We actually we got a new binder. We had a great group of students that we have been wanting, like very common things in the market with the food label. So
okay.
We're very excited to use that now. And we do have food models, but it's nice to show the patients our food labels, and we ask them, okay, pick some things from here that you might normally buy at the market. And then we'll guide them on how to read that label and what the appropriate portion is.
Simona, what's your theory on the fact that eating healthier costs too much?
I always tell patients there's a way.
Mm-hmm.
You know, you can easily, like some of my patients that say, well, I can't cook. I tell them, go get a rotisserie chicken. That's already cooked. Get a salad bag. You know, you can get some pita bread. You can get, you know, any kind of some potatoes, throw them in the oven. If you don't want to do that, just some pita bread, or, you know, have that with the salad and some chicken. You know, I think it depends where you shop, because if you want convenience and want to go to a quick market, you know, you might not have that offering of the fruits and vegetables at a reasonable price.
Right.
But I think we do have that luxury that we can maybe drive a little bit and get a better deal, and we can definitely buy it. And there is a lot of frozen fruits and vegetables too.
True,
That's an option.
true.
So, you know, if you don't want to have the fresh, if, you know, a lot of times patients will tell me, well, if I buy it, it's going to go bad. It's just me. So then I will suggest to them to have the frozen vegetables.
Or take the fresh and freeze it when
Yes.
you get it home.
Yes,
Right? Okay.
absolutely.
Okay. Do you do a lot of education with the family members of the person who has diabetes?
Oh, absolutely. We always encourage the family to be present or to come to our outpatient program. It just helps to have another set of ears and eyes to listen. And especially if it's, you know, the spouse, you know, someone that eats with them all the time, that cooks for them. It's just to have that extra support and that extra ears and eyes is very helpful to the patient.
Well, I just think having you around would be helpful to the patient.
Oh,
so I
thank
think
you.
we have to figure out how to do more of these episodes. And actually, we have a new program that's going to launch here fairly soon, I think, called Shop with a Doc. And maybe we'll take you to a grocery store and help us figure out the food labels, because I think they are confusing to people, especially when it says things like fat-free, low-fat, reduced
yes.
sugars. How do you even know, right? I mean, like,
Yes.
what would you tell somebody if they think that they're eating well because they're eating all low-fat?
So I always tell patients if it says fat-free, then most of the time they add extra sugar to make it taste good. If it's
okay.
sugar-free, they usually add extra fat. So I always tell them they always want to make it taste good. so we can come back and buy it.
So it's a pro-con
Yes.
opportunity cost. Okay.
Yes.
Okay.
So especially like ice cream is a great example. It might say sugar-free, but if you look at the carb content, you might only save 2 grams of carbs if you do sugar-free versus regular, because the lactose has the carbs in there.
Have you seen the high-protein ice creams that are out now?
Yes.
I might be addicted to one of them. I'm just saying. Is that a better option for me?
Well, yeah, because it has the protein, so I think it would be okay.
So
As long as the portion's
I knew
okay.
she was going to say the portion. Darn it. Well, where would you recommend if people are trying to find out more information about, especially gestational diabetes, but even diabetes in general? What's a legitimate source you would point them to? Because it's overwhelming when you go out there and Google type this, right?
Yes. So I would definitely look at ADA here at Providence Holy Cross.
That's American Diabetes Association.
Yes.
Okay.
American Diabetes Association. Here at Holy Cross, we have our diabetes website. So you'll see my picture along with my other 2 wonderful colleagues that work with me.
Mona's fabulous looking, just for you all to see. Go look at the picture.
Thank you. And we have a great amount of resources there for patients. Okay. And we do offer a support group. So if you ever need extra support, you can always come. And all that information's on our website. You can go to ADA. You can go to American Association of Diabetes Educators. That has some information there too.
Legitimate. So
Yes.
people should actually follow it. Okay,
Yes.
great.
Don't ask Dr. Google.
WebMD is crazy out there. Well, Mona, are there any patient success stories or anybody that's just really stuck with you over time in your career that you want to tell us about?
Yeah, actually I've had, recently I had a young girl, probably 22, came in with very rare pancreatitis that they didn't know, was it the diabetes that caused it? Was it pancreatitis that caused it? She was here in the hospital for a good almost 2 weeks.
Oh, wow.
And I had kept trying to see her, and she's like, I just don't feel good, but I really want to learn. I said, okay, I'll keep checking on you. And so sure enough, we got her trained. She went home on insulin, got her, her meter. She said, can I call you? And I said, absolutely. So I think here in the hospital, she started with an A1C of 14, and through numerous emails, texts, phone calls, she'd randomly say, okay, I'm at the market. I have these 2 yogurts. Which one would be a better option? And so then I would help her. Okay, my blood sugar was this, and this is my insulin dose. What do you think? And so I was trying to be a good resource for her and help her because I knew she really wanted to get her numbers down. And she just told me, I think last week, she texted me that her A1C was down to 7.
And 14. That's half.
In like less than 4 months.
Oh, that's amazing. I actually just got goosebumps.
Yeah. And
that's
she
phenomenal.
said she feels like a new person, that she feels so much better. And I said, oh my gosh, that's wonderful. And she was so thankful. She said, thank you for helping me. And, unfortunately she couldn't get into her doctor. She was just hitting so many roadblocks.
Sure.
And I felt really bad for her. So I would try to be as helpful for her as I could. And she did it. So I was very proud.
That's amazing. Well, congrats to that patient. And Mona, thank you for the work that you and your team do. It's so vital and it's so important. And thank you for joining us today, and to everyone for listening and sending in your questions. We look forward to a future topic with more experts from Providence St. Joseph Health. Make sure to follow us on social media at PSJH on Twitter and on Instagram, and under Providence St. Joseph Health on Facebook. To learn more about our mission, programs, and services, visit future.psjhealth.org. Thanks for listening.